Hi, my name is Dr. Christina Rahm, and I'm here today to talk about some of the white papers and literature review and case studies that I've been a part of in the last couple of years. I've done a lot of things in the area of research with the institutional review boards, IRBs, and different things that have to do with really looking at advancements in science. Working in 87 countries, I've been able to work with major scientific advancements as well as government and corporations, which have been able to help further advance the cures and solutions for certain diseases. I never claim to cure anything. I do, however, say that I'm a scientist that's here to really help with different solutions. Today, I want to talk about one of the case studies that was done by Dr. Tina Bosnick, who is the Doctor of the Year in Slovenia multiple years in a row and one of the top pediatricians in the world. This particular case study is about AH, which is an obstructive condition that can occur with or without acute or chronic infection in the adenoids. It's part of the lymphatic system. A patch of tissue is just behind the nose, and this is a condition that can really impact people and their quality of life if it gets too bad. The complications can include significant obstructions, coughing, snoring, and even can lead to sleep disorders and, in certain cases, certain types of cardiovascular issues. So it's a problem when you can't deal with this. In this case study with Dr. Tina Bosnick, it was a 4-year-old male. There were different proprietary blends that were used. One was a silica, vitamin, and trace mineral proprietary blend. The other was something that had to do with L-theanine, velvet bean, pine bark, and vitamin D curcumin, as well as adrenius caffeine. The proprietary blend 3 used black cumin seed oil, resveratrol, turmeric, raspberry, ketones, apple cider vinegar, aloe vera, and D-ribose. In this particular male, the male was diagnosed at the age of 4 and also had signs of eczema and long-lasting colds. The doctor felt like this had to do with the primary diagnosis. They did numerous ENT procedures, but they found out that they really believed it was the functional gut healing that needed to be developed. See, your GI and your gut actually affect the heart and the brain, as well as your whole respiratory and circulatory system. So they were able to use the proprietary blend 1, which had to do with the silica, vitamin C, and trace minerals. They used 1 drop 1 time a day and then increased it to 2 drops 2 times a day for this particular individual. In less than a month, the skin showed less signs of eczema and his stool was normal. The doctor also added very small amounts of proprietary blend 2 and proprietary blend 3 so that the patient could have help with other areas that they had issues with. The snoring completely resolved, and the ENT exams showed that the adenoid status was normal after 2 months.